My name is G.S. Raju. I'm on faculty at the University of Texas MD Anderson Cancer Center, Houston. It's truly a great privilege to answer this question on the video blog. Let's take a couple of seconds to read this question. This is about what question do you consider when deciding on where to have a colonoscopy done? This is a very difficult question for me to answer because there is no national database on outcomes of colonoscopy where one could search and find out who is doing a better job in terms of colon cancer screening. Having said that, the American Society for Gastrointestinal Endoscopy, American College of Gastroenterology, and American Gastroenterology Association, the three main societies, have urged their members to record and report the outcomes of colon cancer screening using colonoscopy. We just started this recently, so maybe in the next few years we will have data that we could look and decide based on the data where to go for colonoscopy. In the meantime, let me take you through colonoscopy and colon cancer prevention. What is the current status? We all know that colonoscopy is widely used for colon cancer screening and colon cancer prevention because of the proven benefit of protection against colorectal cancer. This was based on an important landmark study conducted in this country under the title National Polyp Study, which demonstrated that colonoscopy is 90% effective, or it provides protection against colorectal cancer. However, studies from other parts of the world have reported a lower protection against colorectal cancer. Let's look at the latest news. This is based on a study published in the Annals of Internal Medicine in 2011. And what they've shown is there is a difference between the right-sided cancers and left-sided colon cancers in terms of protection against colorectal cancer by using colonoscopy. Less effective in right-sided cancers compared to left-sided cancers. If you ask the question why, let's first understand what is a right-sided cancer and what is a left-sided cancer. Cancers arising in the right portion of the colon, that is cecum, ascending colon, and transverse colon, are considered right-sided cancers. And left-sided cancers are cancers arising in the descending colon, sigmoid colon, and rectum. Left-sided cancers tend to arise in polyps that are pedunculated, or polyps that look like mushrooms with a stalk. They project into the lumen. While right-sided cancers tend to arise from polyps that are flat or depressed. They're more like pancakes on the wall. And to help you understand better, I've put in this cartoon here. Here is a pedunculated polyp that projects into the lumen. A sessile polyp, another one, projects into the lumen. Both these polyps, pedunculated and sessile polyps, are easily seen compared to the flat lesions that are difficult to see. And if the prep is not good, one could miss these polyps that are hiding under a thin layer of stool, or if one doesn't reach all the way to the beginning of the colon where these tend to be there, one could miss them as well. And if one's eye is not trained to pick these flat lesions, again, one could miss these lesions. In terms of where to get a colonoscopy done, in which center, actually the most important question is who should do the procedure instead of where, because there is a wide variation in the adenoma detection rate among gastroenterologists, as shown here. In a practice of 10 gastroenterologists, looking at their ability to pick up polyps, there is a 9-fold difference between the top performer versus the lowest performer in terms of polyp or adenoma detection rate. And this is seen across the country, whether it is a major medical center or in a big practice or a university center. So it boils down to who is doing the procedure instead of where it is being done. Why is this important? If you go to a person who has a high adenoma detection rate, in those hands there is less risk for cancer development, as shown in this important study from Europe, compared to somebody who doesn't do a great job in picking up adenomas, tend to have a lot of cancers develop in those hands. A big difference between the two groups. So it's very important to have a colonoscopy done by a gastroenterologist who is trained in colonoscopy and who performs the procedure carefully and screens the colon well and removes those polyps completely. So the question is, what questions do you consider in the sedation? I think there are 4 important questions. Clean preparation. That's your job to do. Without a clean preparation, the endoscopist cannot do his job well. He can miss lesions. And as far as the endoscopist is concerned, he should have the technical ability to reach the beginning of the colon in over 95% of the cases, and has the patience and the technique required to screen the entire colon from one end to the other end to pick lesions that may be hiding. And once the lesions are found, these lesions should be removed completely and safely so that they never come back again and they never grow into cancer down the road. In order to help you understand these 4 different topics, we have uploaded some more videos that you could use as a reference. And thanks again for this question. I hope I've been useful in providing an overview on this topic. Thanks again. Bye-bye.